Hi, beautiful families, and welcome back to another episode of Coffee with Dr. K, the place where we can chit and chat about little ones, the joys, the struggles, and the chaotic world of parenthood. Today, we're going to address feeding difficulties with infants. We're going to talk about 4 key reasons why your little one might be struggling to feed and what you can do about it. So, what we'll do first is we're going to take a look at reason number 1 that I typically see in my pediatric practice: restricted neck range of motion. What that means is if your little one is having a hard time turning fully to his or her right or left shoulders and looking up at the ceiling, that restricted motion can actually limit your baby's mouth's ability to suction and form a good seal around a bottle nipple or a breast nipple, thereby causing a difficulty with consuming milk. So, restricted range of motion, what does that look like? And what should it look like? If you've ever noticed that your little one is always looking, let's say, to the right, take a look at the 1,000 pictures you've probably taken of your little one. If they're always looking to the right, or if their head is always tilted to one side in 90% of your baby's pictures, it's very possible that there is a neck restriction. Now, those restrictions can be due to a variety of reasons. It could be an issue with the neck muscles. It could also be something called fascia that we will discuss a little bit later in this video. But what do we do? First, before we talk about what we do, let's talk about what amount of motion your child should have. Your little one should be able to go chin all the way to shoulder, or chin slightly beyond the shoulder, especially a newborn infant, to both sides. And when looking up, they should be able to tilt that head all the way back. You should be able to see their neck, and that's a great time to clean it, okay? So if there's restricted range of motion, it could be due to muscle tightness. A lot of times in infancy, we see a condition called torticollis, very common with little ones, but it does need to be addressed so that it doesn't cause further issues down the line. Ways to address a neck muscle tightness would be gentle range of motion. So that'd be passive range of motion, like you doing the motion. But you would need to follow up that gentle range of motion with something we call active range of motion. And that's when you kind of encourage your child to look themselves actively to the more restricted side. If this is something that you're noticing and you're having difficulty getting your child to achieve this full head turn range of motion, and they're really fussy when they go to look back at the ceiling, I highly recommend you contacting a pediatric healthcare professional, like a pediatric physical therapist, occupational therapist. You can also reach out to your pediatrician and see if they have any recommendations for you. Another very common restriction in your little one's body that could be limiting his or her range of motion is something called fascial restrictions. Now, what is a fascial restriction? Let's first talk about what fascia is. Fascia is what's called a connective tissue. It's a tissue right underneath the skin, right over top of the muscle. So it's sandwiched in between the muscle and the skin, and it connects the skin to the muscles. So fascia is very nutrient dense. It's a very liquid connective tissue, but it also has the ability to restrict or tighten. Now, if you have ever cooked, let's say chicken, for example, when you go to clean that chicken or cook the chicken or maybe stuff your herbs between the skin and the muscle, that white tissue that sometimes you have to like pierce through to get your herbs in there, that tissue is fascia. You'll know the difference between a fascial restriction and a muscular restriction because a muscular restriction is pretty solid. It's going to take a certain amount of time to fix a short restricted muscle. However, fascia, you might notice that your little one loves to look to the right one day. Another day, he loves to look to the left. You might always also see something like they're always curved over to the right side. And then next week, they're always curved over to the left side. Typically, that variation in head turn preference or body tilt preference, if there's a variation there, it's typically a fascial restriction. Now, how do we fix that? Fascial restrictions take a little bit of work. They take quite a bit of hands-on work. It takes some intention to really get rid of a fascial restriction. So in cases like this, I recommend seeing someone called a body worker. So that can be a massage therapist, a pediatric physical or occupational therapist, or any skilled therapist who is trained to work with their hands and actually manipulate or move that fascia and unwind those restrictions. Okay, moving right along. So now we're going to talk about condition number 3 that I see quite often in my practice. That would be something called tethered oral ties, or you might know it as a tongue tie, could also be a lip tie. So any restriction in your baby's mouth that kind of keeps that tissue tethered to their face. That tethering or that restriction of motion limits your child's ability to lift their tongue up maximally, to use their lips and their cheeks efficiently and effectively to consume milk. All right, so when we're talking about tethered oral ties, a couple of symptoms that you will typically see would be difficulty latching. That is a huge complaint from many of my breastfeeding mothers. Difficult latch, painful latch, mom needs to use a nipple shield, shallow latch, all the words you've probably heard and researched. These are very big signs and telltale signs of a tethered oral tie. Now, when we're talking about tongue ties, we're looking a lot at the frenulum. So your tongue should be able to reach the roof of your baby's mouth, and that little tether, that little string you see that's actually anchoring the tongue to the base of the mouth, that's called your frenulum. In some little ones, that frenulum is very short, so they're not even able to get their tongue to the roof of their mouth. And if they can't get their tongue to the roof of their mouth, then they cannot also get their tongue cupped around a nipple, breast, or bottle well enough to effectively suction milk. That could be a problem for the baby and can also be a big problem for the mother. You might also notice something known as chronic mouth breathing. So your little one at rest and during the day should sleep with their mouths closed, breathing silently, fairly silently through their nose. A good tongue resting posture would be tongue is just adhered to the roof of the mouth, lips are sealed, and baby's breathing. So this is how your little one should breathe at night. If you check on your little one and they frequently are breathing with their mouth open, or if they're always congested, seems like they always have a cold, you're always having to suction, that is a big indicator of airway obstruction that could be caused by a tethered oral tie. Okay, so what do we do about that? In cases like that, you definitely want to seek out the assistance of a healthcare professional who specializes in feeding. That could be your pediatrician, of course, a pediatric dentist, a lactation-based physical therapist, occupational therapist, or speech therapist, and an IBCLC or a breastfeeding consultant. Okay, and the fourth and final big feeding struggle I hear about and see in my practice, if you can believe this, is parent anxiety. Feeding is supposed to be like this great bonding experience, a time for you to bond and connect with your child, but understand that sometimes it doesn't go as perfectly as we hope that it would go. And that can cause a lot of emotional distress actually in the parent, and that's the mom or the dad. So a couple of recommendations that I have. Number one, you have to understand that your baby can feel your anxiety. Those waves of anxious energy that you're emitting, your baby actually picks up on that, and your baby responds to that because they're not positive waves. Your baby will respond tense, afraid, crying, unsure, uncertain, and those are not the feelings we're going for when it's time to eat. So what do we do? Number one, understand you're enough. Mom, you're enough. Dad, you are doing a great job. It doesn't matter if you're trying to breastfeed and it's not working. It doesn't matter if you're trying your best to soothe this baby, to put this baby on a sleep schedule, you're exhausted and things aren't working. It's okay. And it will get better. I promise you, I'm here with you every step of the way. But it's going to get better. It's a learning curve for everyone, for you and baby alike. So what I need you, sweet parents, to do when you're feeding your little one, number one, you relax. Get yourself in a nice, comfortable atmosphere, whether that's a quiet and dark room or a lively room if you have a big family with the TV on. Get comfortable, because when you're comfortable, the baby's going to pick up on that and the baby will also be comfortable. Take some deep breaths and really fix your mindset. Like, really work on what you're thinking about. I'm telling you, you're doing a great job. There is no one more qualified than you to work with this baby, to nurture this baby, to raise this baby. And if you have any doubts, it's okay to ask for help. I hope you enjoy this episode with Coffee with Dr. K. I appreciate you being on this journey. I'm happy to be on this journey with you. Feel free to like this video, share this video, subscribe to the channel, and leave a comment below if you have any tips to share with our community. I look forward to meeting with you guys again on another episode next Saturday morning. Bye-bye.